nuclear medicine technologists, and respiratory care practitioners in the state. And our job is to develop a plan to address such a shortage. So I'm one of the co-chairs along with Matthew Green. So we will are joined here with Karen Griffiths, who is also one of the task members. Each one of us represents one of those discipline areas in which we are looking at the shortages for. So I did put together a presentation that we can follow along with, and you can feel free to interject as needed, because I think what we really want to do is hone in on what we need to put forward as recommendations, so that when we meet with the wider committee, we can vote on them and to move forward with that final report for submission at the end of this year. Any questions so far? Are we pretty good where we stand?
No questions.
No, we're good.
All right, perfect. I'm going to go ahead and start sharing. All right, what are you looking at? Are you looking at both or just one?
Yeah, we see both screens.
One now?
Now it's one.
Okay, perfect. All right, so I put together this presentation because the three of us are working as a subgroup to be able to come up with some of the ideas. Our goal is to be able to address the shortage, making sure that we have a strong healthcare workforce for public health. So I'll say some opening remarks, and then we'll discuss the recommendations, come up with a proposed list of recommendations and a final list of key recommendations. We'll talk about the draft report, how we can go about developing it, and then have an open discussion if there's anything that either one of you feel as though we need to address further, or that we should take into consideration as we develop this. So thank you again for gathering to address the critical issue that's impacting our state healthcare system. So we have this growing shortage of radiologic technologists, nuclear medicine technologists, and respiratory care practitioners. This isn't just a workforce issue, it's a public health emergency in the making. The imaging and the respiratory care services that these professionals provide are the foundation of early detection, accurate diagnosis, and timely intervention. So we are the very pillars of our patient-centered care. So we know that our state's healthcare professionals strive every day to ensure that everybody in Connecticut can access life-saving procedures when they need them. But when we don't have that immediate action, we face a future where there's going to be cause for some diagnostic or therapeutic delays. They become more common. So if we think about people that are in need, someone who's waiting longer than necessary for a diagnosis to be able to save their lives, or a child that might have some respiratory conditions who may not receive any timely intervention. So we think about our aging population as well. Anybody who might be facing any critical diagnostic and treatment delays, and that weight itself of the challenge falls squarely on our shoulders to be able to address today. So in Connecticut, we pride ourselves on quality. We pride ourselves on accessibility of our healthcare. But if we don't work collectively to be able to recruit, retain, and support the essential workforce, our well-being as a community is going to be at risk. So the stakes are pretty high for us in Connecticut. And so I think now is the time for us to act, and I'm glad that I'm joined by both Ms. Griffiths and Mr. Green, where we want to look to things such as strengthening our education pathways, expanding any support programs, and incentivizing professionals to stay and serve within the state of Connecticut. We want to be able to explore. We want to look at how legislative action and financial support and collaborative efforts are going to stabilize and also uplift our current healthcare system. So we now have the opportunity to be able to prevent what can become a crisis in the state of Connecticut for healthcare, but build a model of resilient, accessible care. So let's start talking. So I put together some legislative recommendations, and I know we've talked about these throughout the few months that we've been working together as a full committee. But I think it's important for us to think about what's going to work, what makes sense. So when I think about actions to support the workforce, we really want to make Connecticut an attractive place to study, train, and remain as a healthcare professional. So having things such as loan repayment, scholarship programs, tax incentives for tax and shortage areas. So introducing things such as loan forgiveness or tuition reimbursement programs for any students who commit to working in Connecticut after graduation. Looking at those that are entering the fields, particularly targeting underrepresented groups in order to be able to diversify our workforce. Expanding our training programs, that is a challenge for some of the disciplines that we have, because like Mr. Green, you have one program that you've been working with for nuclear medicine, right? For us, it's a capacity issue. And then for Ms. Griffiths, they have programs. There's just not enough people in them.
Mhm.
Am I right? Yes.
And it's a state trend and a national trend.
Correct. So we're looking at how can we come up with other types of expansion. So that's possibly thinking of fast track or part-time options for working adults. So those that need to make that change in career. Clinical site support is always an issue. So maybe offering to the clinical sites incentives for healthcare facilities to serve as sites, tax breaks or subsidiaries to accommodate more students. Looking at streamlining licensing for out-of-state professionals. We have simplifying the process for out-of-state techs and practitioners to get licensed in Connecticut. So encouraging more to move and work here. And then looking at things such as the recruitment campaigns, retention programs for current workers in each of our fields, and offering professional development opportunities. So what do you think about those? I mean, obviously there's a lot that we can have.
Sorry, I'm just pulling up my slides from before. So I agree. I think these are hitting most of them, and the ones we've talked about in the previous meetings. The one, and I think it's written just differently, is, possibly grant funds, and just that can be more trying to figure out partnerships. And I think this would apply to all the fields we have here, but partnerships with our hospitals to be able to send students. I know that's an issue across the board with all the programs, is getting the clinical rotations that we need, that we can help train our future task force. So having grant money that we can come up with maybe creative pathways to do this. And the grant money, I kind of was also thinking for hospitals to do career fairs within the hospital. We had talked about in previous meetings having, there's a lot of workers in hospitals that want to advance their career. They may start out as a CNA or a PCA, and to be able to advance their career. So having work fairs within each of the organizations. And so possibly grant money to help with fund those types of fairs, as well as funding fairs for high school students.
Yeah. Ms. Griffiths, you're like reading my mind, I think. I actually think you're reading my mind. So supporting educational institutions, right? So expanding those pathways to enter the field. So we're investing in a sustainable and qualified workforce. So when we start to build from within, like you're suggesting, that would help us in the long run. So looking at those things such as that educational incentive. So introducing loan forgiveness or tuition reimbursement programs for students, again, who stay in the state, scholarship and grants, providing them for those that are entering the fields, particularly when we think about the underrepresented groups, or going from the non-clinical to the clinical track. So those individuals that are seeking that type of expansion. And then looking at development again in those enhanced clinical training partnerships. So there's quite a few things that we could talk about. I don't want to monopolize the entire meeting, but I do want to be able to talk about the different types of things that we can do. Like retention is a big thing, right? So there's a lot of issues with keeping people here. So retention strategies to be able to keep our experienced practitioners and technologists within Connecticut. So that would help to enhance the continuity and the quality of care. So again, simplifying the process, developing programs. I have a couple programs, similar to the magnet for nursing. So Mr. Green, you can probably appreciate that one. So just the idea of magnet recognition, but in a different view set. So supporting our students. So by doing this, we are creating this strong pipeline for tomorrow. So paid internships, residency programs, public-private partnerships for job placement, workforce commitments, and then looking at supporting the healthcare facilities, because I think one of the big things in our area is the clinical incentives. And I know, Ms. Griffiths, you had discussed some challenges in respiratory care practitioners, when you send somebody out there, right, you have to, it's at a cost, right? So it's at a cost for that particular program to have a student at that facility. So by having any types of incentives, such as tax incentives for hiring and training in those high need fields, subsidies for clinical training sites, so offering tax credits to the facilities that hire and train them in our areas, it helps them to hire in those shortage areas and encourages them to, and it will receive the facilities will receive the tax credits for every new hire, hopefully, and with additional credits for retention after a defined period. So we also have those subsidiaries, if Connecticut can offer matching funds for facilities that cover stipends or wages for traineeships, with priority given to those areas that are in high need. The partnership. So I know that a lot of our institutions do partner with some educational facilities, but looking more at how can we further help in the partnership, helping to reduce that debt burden that goes onto the student, encourages that long-term commitment. So looking at how the state might be able to match facility contributions towards employee loan repayment. So things such as that. So that'll help be more attractive for someone to stay here. I have some other things here, but do you have any questions about like what other types of supporting the healthcare facilities list? Like looking at what I have on the list here.
No, I think my thing is going to be, and all these are great, and I know we've had a number of recommendations through the last few meetings, is, you know, and this we can ask for the whole group to kind of assist us with. How streamlined do we want to make this? Do we want to keep a big list? Do we want to streamline the list? And that's where possibly recommendations from the rest of the large group might be helpful in this one. Yeah, but these are all great. Like, these are all important things that we've been discussing.
Mr. Green?
Yeah, so I guess I just have some, I don't know, clerical questions. You know, I've reviewed the kind of the template and then the one for the, you know, the mental health that they sent out for adolescents. Is that the format that we use for our report, or do we have some leeway in that?
So that was a pretty comprehensive report.
Right.
I don't believe that our report will be as extensive. There's not as much, I mean, there's not as much detail as would go into as the example they had provided to us. I think that ours will definitely be shorter than that report. I think we just need to hone in on what areas, and that will be what the wider committee is going to help us with. So try to cut it down to a reasonable, or what is the word I'm looking for?
Streamlined, maybe?
And manageable, something
manageable, right? So a manageable list. So like these can go underneath a header, so it can go underneath a main area of a recommendation. And it doesn't necessarily, we're not going to put all of these down, but it could just be incentivizing facility participation. And then we can just pick out which areas that we would like.
Right, because the one I'm looking at sort of structured it with, like, they listed the 40 whatever recommendations they had. Right. And then they clustered them, right? Then they titled your clusters of cluster 1, 2, and 3, which go to that. So it looks like we're starting more where we just have more clusters, right?
Right,
So,
right.
very specific recommendations, then they kind of tie them back together to 3 or 4. So I guess I'm just asking, what are we going to go back to the broader committee and have them vote on? Like, right, are we
Yeah,
trying to find 15 to 20 recommendations, then using this format cluster them? Do we want just recommendations and then you go ahead, sorry.
yeah, no, I was personally not looking at 15 to 20.
Right.
I was hoping for maybe 5, maybe 5, that we feel as though they can that they can look at and feel as though it's something they can accomplish. I think that if we come up with something at 15 to 20, I believe it'll be too much for them to address in a timely manner.
And one of the recommendations that was made at the last meeting by Senator Kristen Vehe was to keep it simple. Like that kind of stood out with me. She said, I think she said, write it at a kind of a low level, not because they're not bright, but because they're not as familiar with this language as we are. So I think keeping things simple makes a lot of sense. She said they were going to be doing going through a very large number of these reports. So it could be overwhelming for them if they're too complicated.
Right. I agree. And I think that we can talk about the specifics now, and then we can make it more comprehensive for them to understand in a shorter format.
Yeah.
I don't think that it needs to be as long as what the example that we received to review.
Right. So my thought would be, do we have the leeway to read in our report? Do we want it to look more the reverse of what they're doing? 5 simple, sort of recommendations, right? Using this, like, we
Right.
need more support for healthcare facility, a little wordier than that, and then show them, and then in the body of it, then kind of lay out a little bit more of like what that looks like.
Yes.
Instead of
Yes.
this way of doing 47 comprehensive, very intricate recommendations, then trying to bring them back to why.
Right. I agree. I think that we should have it as, here's the recommendation, here's the rationale, here's the benefit. So I think that it should be in that kind of format for each individual one rather than listing them out. That's just my personal opinion.
Okay.
But we should prioritize, and we need to ask how, when we meet, once we decide what our recommendations are or what we would like to move forward with, then I think we need to prioritize what we want as a subgroup to put forward and in what order.
Bernadette, can you repeat? I like that layout, and I missed the last one. So number 1, we lay out our recommendation. Then number 2, we put our rationale. And what did you say for 3? The explanation, was that it?
That's a great question, Karen. So it was the recommendation, the rationale, and the benefit.
The benefit, okay.
You're quizzing me.
I was writing it out and I just missed it.
That's
sorry, I didn't mean to quiz.
No, it's okay. So as I had mentioned at the beginning, there currently is not a widely recognized program identical to the magnet recognition program that nurses have at their institutions. So thinking about what type that we would have for our areas of discipline, we can look at potential avenues that Connecticut can explore to adapt a similar designation or a recognition program in order to attract and retain professionals in the fields. So these are just ideas, just names that I came up with. State level Center of Excellence designation, excellence in imaging and respiratory care, Connecticut Health Workforce Leader, and then you just like workforce, a workplace of choice, just different types of ways that we can recognize and give the institution something else that they can use as a benefit to having, or to those that are coming to work in our fields, why they want to work at this institution. So just being able to be recognized.
Bernadette, I love this. I'm just wondering how this would go into our report. Is it a recommendation that we're asking legislation for? Is it something we're hoping hospitals will do independently? Is it a state level? What are we hoping for on this?
So there are some that are state levels. So Mr. Green, are you familiar with magnet recognition?
Yeah, I don't know who, I think there's only one, it's Middlesex is the only hospital-based system that has it, correct?
I believe that there are other ones that have it as well. The magnet recognition, I believe Yale New Haven Hospital has it. So
Is it a national recognition or state?
it is a type of, I'm not quite sure.
Okay.
Yeah.
Yeah. So I think it's something that we can definitely look at, but it is a different type of recognition, and maybe there's an incentive program that can go along with that. So if you are recognized as this certain level, then your institution will receive some type of funding, state funding, federal funding,
Okay.
some type of funding associated with it. So that was my thinking behind that recognition program.
So I just kind of logistically would want to know how we think it would work, how we anticipate it working, and then who would we need state funding for? Are we asking for legislative support to fund it is really what I guess, as we're coming up with these recommendations, I think we have to kind of characterize them as these are going to help our profession. These are things we need to do. And these are things we need state support for, legislative support for. And if we were to say it was a state excellence award, right? And how do we define that, and who decides who gets it?
So I think that the facilities would have to come up with benchmarks. So benchmarks that would determine what determines them to be excellent. So looking at workforce, the employment, the retention, the support, the satisfaction of staff, outcomes, patient outcomes, and commitment to development in those areas. I think those are sorts of things that would make a state level center of excellence. But if it's an idea, it's not something that I'm married to. It was a different type of recognition program that I was hoping to be able to provide, similar to what nursing currently has.
I actually agree with it, and I like it. And when we were doing the surveys for that month we did the surveys for our program directors and our hospital managers, I did get feedback like this. So I agree with it. I'm just trying to logistically think about how we can put it in a report and how it would work. And I'm wondering if we would have put something in for grant funds, right? Grant funds for hospitals. Could this be something that the hospital is able to do with their grant funds if they feel like, okay, we've met these benchmarks? I'm not sure that we can somehow do some kind of reward. And I don't know logistically how this would work. Matthew, were you looking up a little more on the magnet one that we were talking about? I'm curious a little bit.
Yeah, so it's the ANCC, which is American Nurses Credentialing Center. So they are the ones that oversee it, and their criteria is high quality patient care, nursing excellence, and innovations in professional nursing practices. So it's a independent body that you try to attain magnet status through.
So it's a national award that hospitals in Connecticut apply for.
Yeah, and it's an ongoing basis. You have to keep your metrics up. I know one of them, because I don't believe Hartford has it, and it's not solely, but it's based on nursing. And their big push when they went to have all their nurses to have bachelor's degrees, because that's part of, just for an example, part of it is, I think it's 80% of your workforce of your nurses have to have a bachelor's. So they have all these metrics that you have to meet, and then you hit magnet status. And then on a rolling basis, you have to continuously keep up with these. But going back to your original point, it's a national accrediting body.
So if we're looking for something on a state level, would it have to go through our state organizations for them to appoint, or would it go through the individual hospitals?
I think it would have to, like Matthew had said, it would have to go through something on a national level. So for instance, ours would be probably our national organization. Caring Yours would probably be an
AARC. Yeah.
Exactly. And I think just partnering in that way to come up with some metrics, then that would allow you to be able to come up with, and so it speaks to excellence in care, right? And if you meet the certain benchmarks, then you have the possibility to be able to get funding. So opportunity for funding, grants, things like that. And that can be used towards workforce development.
Okay. So we would possibly ask for state support for hospitals to meet these benchmarks. So I think we would have to see if there's benchmarks for this already.
Yeah, I think you'd have to look to see what state grants or state funding is available, and somehow add these disciplines to those.
Okay.
An example, I have a couple examples,
Sure.
a little, in my slides. So you had mentioned HOSA in the past, so I wanted to make sure that we talked about HOSA. And so just looking at the future health professionals and leveraging HOSA as a powerful strategy to be able to engage students coming from the high schools, as well as, so introducing them to our areas. So creating scholarships for those fields, having statewide competition in these areas, internships, summer program development, mentorship through the programs along with your professional organizations or associations, and then partnering with the colleges and the universities in the state. So I think this is something that it already exists, but it's a good way to be able to continue to engage the high school population.
I agree. I think this is a really great way to engage. It's what our national organization has been promoting for workforce shortage. I think one of the problems in Connecticut, and this is a deeper problem, I believe, than just this task force. One of the problems in Connecticut is that we have, I believe it's 31 chapters of HOSA in Connecticut, but there's a lot of high schools. And what's holding them back is that they need to have somebody who has a health science certificate, and that's not that common. It's not as common as other types of certificates. So is that something long-term that the state can help coordinate, having more schools with that have that opportunity for students to take health science classes and learn more about the health, the various professions within the health science, within health. So it's not just our three professions, but all professions, because we know that there's a shortage in many health professions. So similarly to where they would have engineering pathways at high schools, can they have pathways where students learn more about the healthcare careers? And this would be through a certification that you would get. It's a health science certification. And when I talked to someone from the state of education, they said that there's opportunity at many high schools to have this position, but there's not enough people with this particular certification. So some kind of coordination, and this, I don't know if it could be in our report that we're recommending it. I don't think it's something that we should be recommending for legislative support for our three groups. I don't think it's an immediate fix, but I think long-term, it's something that needs to be looked at.
Right. I think you're right. I think it should be something that's looked at as a pipeline to the healthcare professions. I think that certainly funding can be provided to help to develop those certificates at more of the chapters for HOSA.
Yep. And then the existing chapters, I agree with all of these, trying to create more pathways for them to learn about our programs, for maybe the people who are already in these HOSA chapters to come visit to the local colleges and universities, so they get to tour and to see what kind of health professions they're interested. And specifically for our task force, we want to try to get more people interested in these fields that we know have major shortages and critical shortages.
Right, exactly. All right, so leveraging the Connecticut Health Foundation. So just partnering with CHF for a stronger workforce. So they have a commitment to health equity that aligns with the mission to be able to strengthen and diversify our workforce. So we can look at how they might be able to provide funding. They can help with advocacy, so public awareness, and looking to see how they can help us with our different areas. So grants for educational program expansion is something that I was also thinking about. So looking at this foundation to be able to help with capacity building in our educational institutions. So offering the grants to colleges and universities to be able to expand or create other pathways. So funding can help to support new faculty hires if there's areas of shortages. I know nuclear medicine probably will have a shortage if there's only one program here in Connecticut, to be able to look at who else is able to provide that type of training, facility upgrades if needed, technology resources in order to be able to take on more students. Looking at pilot programs, so looking to see how we can pilot programs through CHF to be able to, how do you create a part-time pathway? How do you create an accelerated pathway? So looking at those types of incentives. So that was just, and then this is not something that we support in our field as an entry level, but student stipends. So that's not something that we would support in our field, but possibly a stipend to a clinical instructor at a facility would be something that would be able to be provided. And I know that's probably one of your concerns in your area, Karen, for respiratory care.
Yeah, absolutely. And we do the respiratory therapy education in Connecticut. Most of the hospitals are making us pay for clinical instruction, and it's a big, it's a difficult task to be able to provide that fee. It's fairly expensive. We're paying what the going rate is, if not more, of a respiratory therapist for them to take our students for the day. So that's it's a challenge for programs.
Yeah. One of the big ones is Connecticut Health Horizons grant. So this is something right now that is, we might be able to see if there's a way that we can expand the grant to include not only nursing and social work, but also imaging and respiratory care. So with this, we would be able to seek additional or federal grants, similar in state funding, similar to supporting to prioritize our development in these fields, and looking at how we might be able to leverage our partnerships with any of our healthcare facilities. So this current grant does not include imaging or respiratory care. So, and I think it was recently expanded to include social work. So it's something that we might be able to look at, and this is a Connecticut grant. So maybe it's something that we might be able to gain support from to be able to help with funding for incentives.
Definitely, that's a great idea.
Yeah, and then the Connecticut Student Loan Repayment Program, currently it does not include allied health professionals. So looking to see if we can strengthen loan repayment options to include allied health professionals. And this would help us to be able to, to make sure that we receive the same benefits as other healthcare workers as it applies to this. So there are things such as increased repayment for a long-term service commitment. So looking at flexible repayment terms, adding a bonus repayment for anybody that stays on long-term for retention, commitment incentives, and then help to facilitate some early career loan repayment programs. So I think this is also another option that we might be able to ask for support from. Again, it is all about the cost of education, right? So it is about the cost and the cost to live in a state like Connecticut. So I think these are things that would help to make us more attractive for those that are training or those that are looking for employment and help with our shortages that we have. National programs, there are some that we might be able to look at to see how Connecticut can support or adapt the models to address our own shortages. So those would be our professional associations. Those are any of the ones that we all belong to. Federal grants for workforce development, and then our military health profession scholarship program. So these are things that you might be able to pattern ourselves or pattern Connecticut after. In addition to that, we can look at our institutional and private foundation support. So any types of traineeships, looking at private foundations and charities for all of those types of assistance. So an example of a private foundation would be the Robert Wood Johnson Foundation and Tylenol Future Care Scholarship. So sort of things like that. We might be able to create a state matching program for foundation grants where Connecticut would match a foundation scholarship for students that are in these critical areas, and then amplify the support and encourage private foundation investment in our workforce.
So I'm kind of going back to that one for a minute, Bernadette. So I'm not that familiar with some of these. Is it small scholarships? Would it make a big impact on the shortage, or is it going to affect just a minority of people going to these programs?
So with the healthcare institution traineeships for this, I was thinking of more helping to provide those tax incentives to our healthcare facilities so that they can create traineeships in these high need fields. So that will help to cover the costs and encourage job placement for anybody that might be seeking a job after graduation. So it could be, it really would depend on how much. I know Robert Wood Johnson is a larger scholarship. It's a larger foundation, and they do offer various scholarships, but they are competitive. A lot of these are competitive.
Okay.
And so.
Well, I was going to say, would it be up to the student, the potential student, to find those scholarships? Is that something it would be, or?
So I think, if they were going to work at a facility, right? So if you think about, if you're going to work at a facility, or if you currently work at a facility and you're looking to get into one of these fields, they may have something in their benefit plan, like if they are partnered or if they have this healthcare institution traineeship, that they might be able to offer to them for anybody that's seeking to further their education or to go into a different field.
Okay, thank you.
So it's like a benefit incentive.
So possibly if they were doing career fairs, it could be something they promote at a career fair, that there's these, if they apply, they have these, they possibly could get these benefits.
Right. It's kind of like that sign-on bonus, right? So it's kind of a sign-on bonus, but in a different way.
Yeah.
So we are looking at how we might be able to work together, come up with plans. So come up with our recommendations. We want to look at how we can address the needs. So I talked a lot.
That's okay.
I'll stop talking. But I think what we can say is that there's a lot of opportunity out there that Connecticut can use to be able to help and support a workforce shortage in these areas. So there's a way that they might be able to look at any of the recommendations that have been put forward for legislative, because we in each of our areas can look at our own advocacy, right? So a way that we advocate for our professions, but we need support from our legislative to be able to help with these areas. We want to make sure that while we can't prevent the shortage, it's already here, that we're going to minimize the effects that it has long-term.
I agree. You did a great job. Thank you for doing this and putting this together.
Sure.
I think in the report, we probably should really put a component in there on the impact, and we've talked about this in our previous meetings, but the impact that the shortage is going to have on healthcare, on the people of Connecticut, right? The people who are seeking healthcare in Connecticut. You know, for radiology technology and I believe nuclear medicine, we talked about things like they're not going to be getting their imaging and in a timely manner. And, you know, for respiratory therapists, if there's not enough, that it could be, there's data to show how it can negatively impact the patient outcomes, the patient care. So I think getting this information and putting some of it into the report to, in a simple way, to really make sure that whoever is reading this report is able to truly understand the impact or the negative impact that this shortage is going to have on the citizens of Connecticut. And then hopefully we can maybe go on to talk about some of the things we've discussed in these meetings, and then the recommendations that we've come up with. And I like the way we had you formatted the recommendations as the recommendation, the rationale, and then the benefit.
Okay.
So maybe as a kind of a starting point.
Sure.
For the report.
I agree. Mr. Green?
Yeah, no, I agree, because reading this, and that's what Congressman Behe was saying, is to kind of try to tell a story, right? Like, if I tell anyone about nuclear medicine or, a stress test, I oversee like a cardiac rehab as well. Unless they know someone in there, they think of hospitals and what we do as doctors and nurses. They don't realize that they need a nuclear medicine department to have a stress test after they've had a cardiac event, right? Or precursor to a cardiac event. So I think that's to lay it out. They don't realize when they're in ICU that an RT, is just, I'm a nurse, so I can say this, is just as important or probably more important to them surviving their stint in the ICU. They just view everyone as doctors and nurses,
Right.
So I think that's our lift in the beginning, is to open that and then to recommend why. So I agree with Karen on,
kind of I like the way you put it, of telling a story. And we want to tell this story for, as Senator McCahey, am I saying right, hopefully, as she told us last meeting, we want to say it in a very simple terms for people who aren't really in healthcare. So do you want, this is my recommendation, you guys tell me if you like this, maybe each of us should write a piece for our own profession. If we put this, and then we kind of have like 3 paragraphs in the beginning of this report to kind of discuss the shortage. These are things that we've talked about throughout these meetings, and kind of, and all things I know, we've all talked about these quite a bit in all of our meetings, a little bit about the profession, why it's so important, what the impact of the shortage is, and maybe the current numbers as well. I know we have national numbers. The state numbers were a little bit, I think they needed to work on that, maybe a little bit from the last meeting, but really talking about some of the numbers, putting the data in there too. Do you guys want to do that individually and then kind of put it together? Do you think that would be helpful?
Sure. Yes, that would be helpful. Just to put a little bit more panic into us. The next meeting is scheduled for, I believe, next week.
Oh,
so,
okay.
So
so we got to get at it.
We're just waiting on confirmation. So
not Monday, right?
No.
Okay, good.
I think it's exactly 7 days from now.
It's Wednesday. Okay.
Yeah. So I think what we need to do is, the report's not going to be completed. What we need that, but we can work on the narrative for each of our areas, right? So we can work on that. But I think we need to get the recommendations forward and have a vote on it so that we know what we're going to include in the actual report itself. Okay.
So do we want to, can we just talk about that now? Some of the things that we feel like?
Sure. So I had put forward the the legislative recommendations were the loan repayment scholarship programs. Yep. That was one of them. The second one was tax incentives. So that can either be for technologists or facilities. Funding for educational program expansion.
So the first one, do you want to go through them? The first one, that was exactly what I had put on last meeting. So I agree with that. Matthew, do you as well?
Yeah, I agree with that as well.
Okay.
All right. And then underneath that, under the loan repayment and scholarship programs, I think we need to add a little bit more information to that. So that we can, if they question us, we have the ability to talk more about the rationale behind why we believe that that's a legislative action that the state can help with.
Absolutely. And we can talk about with the loan sorry, I'm just pulling something up. We could talk about the Horizons grant that was passed for nursing and social work in 2022, because I think that kind of follows suit with that.
Mhm.
And especially, like I think you mentioned earlier, is scholarships for those students who, providing tuition assistance for students, for creating different pathways for people who can't afford it. So we're trying to get people into the profession that otherwise weren't able to afford it. So providing that tuition assistance, similarly to how they did it in the Horizons grant in 2022 for nursing and social work. And I think for loan forgiveness, that was passed this summer for nursing and a number of other professions, but not, like you said, not allied health. So trying to get us to add into that loan forgiveness.
Yeah,
I think
it's student loan repayment program. So that
student
one.
loan, I'm sorry, I said it, you were correct. Student loan repayment.
Yeah. So leveraging that in order to add all allied health professionals into.
Yeah. Or at least the three of us.
Yeah.
Right. I mean, saying all allied health might be too broad, but I think saying respiratory, radiology, technology, and nuclear medicine is probably definitely something we should be doing.
Okay. All right. Perfect. And then are we good with those as options, as suggestions, as recommendations?
Absolutely. Both
Okay.
of those for sure.
And then the next one was the tax incentives.
And I'll be honest, I don't fully understand what we're looking for on that one. So
Okay, so looking at so for the tax incentives, looking at how we might be able to ask clinical sites to be able to take on more students. And part of the problem is that there's not enough people, so the people that are there are working harder, right? So we know that there's that burnout factor that we have to consider. But if we have a way of helping them to be able to provide like subsidiaries or tax breaks to those facilities to be able to take on more students, I'm not sure how we would do it or how we would ask. I'm sure there's a funding that's associated with it that we might be able to tap into. Maybe using maybe using the recognition program as a way to leverage state funding.
So I think I was kind of saying something similar, but not, I didn't use tax incentives. That was kind of where I was going with the grant money. To use the grant money as incentives for partnerships between programs and hospitals to be able to assist with different things such as clinical internships. Certainly tax incentives could be helpful too. I don't know enough about how that would work or what we need to ask for. But I know with the Horizons grant in 2022, the grant, there was a component under there that was grant money, and under the grant money were things like clinical partnerships. So I was kind of modeling it after that grant that was already passed, that maybe we could use that. And the other reason I left it vague when I kind of made the presentation is the respiratory needs may be slightly different than radiology, technology, and nuclear medicine. For us, it's a huge cost for hospitals to take on, especially since we work in the ICUs. So we need small ratios, and it's a huge cost. So to offset some of the cost for the programs for the hospitals, but for radiology technology, my understanding is there's such a shortage in the workforce right now that nobody can actually take students, and it's making the shortage even worse. So potentially you could have more students in the program if you had more clinical sites. So for having that grant money to assist with giving incentives for people to take students. So it would still be grant money, but maybe used slightly different depending on what is needed for the profession. That was just my idea. I'm not against tax incentives. I just, I truly I don't understand it enough to know what we would need to recommend or how it would work.
Okay. All right. Maybe I'll try to describe it better?
No, and you described it well. I'm just not really, and tax incentives could be great. Do you think that we should also be saying grant money too, or to kind of use it as, I was kind of thinking grant money as an umbrella to see what works for each profession.
I think we can separate it out. I
Okay.
think definitely separate it out. I don't know if I would want to put them together.
Okay.
What do you think, Mr. Green? Any thoughts on that?
So I'm sort of in the same boat as Karen. I don't fully understand the tax mechanism. I know, because I now work in a for-profit, entity. I've worked in nonprofits. They're trying to go back to nonprofits. I don't know how the tax mechanisms work for these large systems and where the clinical sites we use.
Mhm.
So it's sort of one of those things that I don't know the ask. I think the grant, to be fair to me, is just an easier thing to understand. We create a grant, we disperse the money to, for certain purposes, for facilities or schools to use to get into facilities.
Okay. All right. So, oh, I lost my slide. Sorry. All right. So I'll see if I can make it a little bit more clear. So maybe not for the facilities, maybe for technologists or practitioners, tax incentives.
Yeah, and well, even program,
Or programs.
I guess, yeah, supporting the programs getting in, how do we get them? Same boat as, Karen just said that the RTs have to pay their own way. I don't know how the nuke med or, to be fair, I don't know how the nursing works. I don't even, I don't know how their clinical apparatus is set up. But I know it's expensive and it's a lift and we struggle for clinical sites.
Yeah. Just as a side note, I was thinking about nuke med and rad tech and they kind of talk like they kind of are similar because they're both imaging types.
Yes.
That there is also a growing field of the PET CT and the PET MR. So combining those two technologies together. So that's also a concern that I've heard out there, is that there's just not enough nuke med techs that have the ability to do CT or nuke med techs that have the ability to do MR. So that is also one of the concerns that I've heard out there. Sorry, I sidetracked us, but
No.
No, I'm actually happy you brought that up, and this is not my profession, so forgive me for this. But why, this may be naive of me, but why wouldn't nuclear radiology be with some of the rad tech programs? Why is it a separate program?
it actually is its own entity. So you can be a nuclear medicine technologist without being a radiologic technologist.
Okay.
And correct me if, obviously Bernadette can speak to this better, but the typical pathway is like you become an X-ray technologist, right? And then you differentiate out into, CAT scan, which is X-ray, MRI, but there's pockets in the imaging world, right? I guess imaging is the overarching, right?
Yeah.
Not really, so you have nuclear medicine, then you have ultrasound. An ultrasonographer doesn't necessarily have to be a rad tech first.
Okay. So similar to an ultrasonographer, which can be a rad tech first and then go on for that can I say specialty?
Yeah, sure.
Specialty certification. Could a radiology technologist go on to become a nuclear medicine specialty? Is that a path that people would use?
Yes, you can.
Go? Okay.
Yes.
But it also can be a standalone where someone can just go as an undergrad and get a degree?
Yes, as a nuclear medicine.
Okay, thank you.
You're welcome. So I think as we, continue to look at these things, so funding for those educational program expansions, right? So that's something else that we can talk about. So that, do we agree with that?
Yes.
Okay. And then I didn't hear anything from you guys about the streamlined licensing for out-of-state professionals. So what did you think about that?
It was something we had earlier, compact licensure. From when I talked to you know, the Connecticut Respiratory Board and our lobbyists, they kind of felt like we were addressing that in other ways, that it wasn't something we needed to necessarily, it's something we're pushing for and we want. I'm not sure it's something we need legislative support for at this point,
Okay,
is kind of what the gist was, but it is something that we feel would be helpful, especially for those border states. So having a compact licensure, you know, maybe New York and Connecticut or Massachusetts or Rhode Island, Connecticut. So having that compact licensure would certainly help, and it would help for people on those bordering states to be able to work in both.
Yeah, I don't know. I think it's good for those specific things. As a true nutmegger, I've been here my whole life in Connecticut. I don't know. And as a hiring manager, I don't see much matriculation into the state, right? There's a few pockets, but it's not this huge, like, hey, we'll take your license, come on, move here. The compact stuff that I see in the nursing world as well as the other world is really I see a benefit for travelers, right? That managers can get people in quicker to stopgap. I would like to see, and I hope you guys agree, I'd like to see more of the state focus on education, people here, supporting education programs, the clinical here, because I think that's the long term. Not that compact's not great, not making licensing easier is not good. I just think long term, to help the long term needs of the state is, the more grassroots in the educational systems, like fill your seats, right? Fill the RT seats, expand the seats that people from Connecticut are going to take at our schools here that will stay here.
So when I polled, we did the poll a few months ago when we polled all the hospital managers and also the program directors. The only people that really mentioned the compact licensure were the border states, and for those places, it was a big deal. Yeah. So I do think that it's something that could be helpful, but I also agree with you, Matt, that is it something? If we had to pick just a couple, is it the one I want to pick? Probably not. And I do think we're addressing it from a different direction. So, and it's something that for respiratory, at least we are addressing it from our board, from our state board. We're working on that. So I'm not opposed to having it on. It's not, if I had to choose, it wouldn't probably be my first, second, possibly even third choice to put on. But if someone felt really strongly, I wouldn't be opposed to putting it on.
Agree.
Okay. Yeah. I think with, and then I have recruitment campaigns for imaging and respiratory fields. Yes.
Yeah.
Yeah.
Okay. So the only thing that we're kind of leaning away from on that legislative recommendations was the streamlined licensing. It's not a priority, right? The compact licensure is not a priority.
It's
on a list and just down below.
It's not it would be on the bottom of the list for me as what we're talking about. It's not, it's important. I don't want to say it's not important. It is important.
Okay.
Yeah. But it's not the top importance, I think.
All right. So we'll leave it there as at the bottom of our recommendations that they should consider.
Yeah.
So number 1, do we agree loan repayment and scholarship programs?
Brenda, can I just say one more thing on the compact licensure? I'm also not sure that it would be something like we would need money, like grant money for. That's like kind of the other reason when I was talking about it with the respiratory world, right? Like, is it something we need to put in this committee as legislative support for? And that even though we felt like it was important, did it need to be on this committee was more of the discussion. But sorry, I didn't mean to, I just wanted to kind of point that out. But sure, go ahead.
Are we in agreement that one of the main things is the loan repayment and scholarship programs?
Yes.
And then underneath that, we can talk about the Connecticut Horizons grant and the Connecticut
loan repayment.
Yeah, the loan repayment.
Yep.
So the Connecticut Student Loan Repayment Program.
Yep.
Are there any other ones that we wanted to leverage in there? Do we want to talk about the Connecticut Health Foundation, seeing how we might be able to partner in that way?
Yeah, I think that goes with, you know, the horizon, like leverage these
Three known.
existing entities that they could help fund or expand, right? You know, if Horizon's just, I think it's only a 3 year that they had funding for, you know, if they re-up it and expand it to these other modalities that we're bringing to their attention.
Mhm.
uh, and
I
the things
believe
that can help.
nursing is also in the process of something like we are now to redo their next one. So that my understanding is the Horizons grant was 22 to 25, and they're working on the next phase, or say phase 2 or whatever they're going to do after that initial Horizon grant. What I'm not that familiar with, the Connecticut, what was it called? Connecticut Horizons?
The Connecticut Health Foundation.
Connecticut Health Foundation. Are we hoping, it was what you're saying, you're hoping they will help with loan repayment? Is that, or
Might be
is
able to
that
be
different than the state?
So they can help with funding, they can help with advocacy, they can help with any support for programs.
Okay, and so right now, if we're looking at nursing with their Horizons, are they going through that to get the funding, or is the state providing the student loans and the loan forgiveness?
My understanding of it is it's through the institutions, that the institutions then hook you up with this Horizons. There's a cap for each institution per year. And I think it's the Connecticut State Colleges, Central. There's a specific ones that are funded, and it's just like when you get your financial aid list of Pell Grant, loan, Horizons, right? So when you're in these, is that?
So do we need to specify that, or can we just say we think the state needs to help with this and they decide where it goes through? Does that make sense? So if we say the state, we'd like the state to help with student loans, tuition assistance, or loan forgiveness, or grant funds for that matter, do we say we want it to go through these organizations, the Connecticut?
I think we can
Health
talk about,
Foundation?
I think we can talk about the 3 currently existing.
Okay,
So we can talk about the way that they exist now and how they can be further expanded
okay,
in order to include.
okay.
Do we agree with that? Yes. Okay.
Yeah, you know, the recommendation would be to expand, or we love our own Horizons program. You know, we'll take our own. It's, you know, if the expansion's easier, you know.
Yes,
Right.
100%.
Yeah, and there were other ones that I had mentioned just about how the state might be able to partner with a national organization to help with funding. Also, do we want to add in national organizations or professional associations, or do we want to stay away?
I think it's complicated. I personally vote for staying away because I'm not sure how logistically it would work. And I don't want to make I want to make it very streamlined. So when we're asking for recommendations, they're very clear and that they can grant it or not. If we start saying we're going to work through our national organizations, what to say, but wouldn't the state say, well, why don't you just use them instead of us if they have any money? And I know our national organizations, you know, they do give us some, like, for example, we had 2 years ago, they gave all programs $5,000 to help with tuition assistance. 5,000 doesn't go very far. And this year they did 10, which is great. We're giving some tuition assistance to some students, but that's not going to go very far. And I don't know that partnering with them is going to make that any different. We already have that. And I feel like it might muddy the water.
Okay. Okay.
What do you think, Matthew?
Yeah, I think I think it's the same thing. It's nice and, you know, an avenue, but I think just right there, we were talking about the Horizons program. I think that's easier for them to understand. Like, hey, look at this program that you're doing for nurses and social workers. Let's not forget about these other people that we need that you may or may not know about. This is what it exactly looks like. There's so many national organizations, and we're, you know, slightly fractured with the RT, Nuke Med, you know, all these different things. I think
that's a good point too.
It wouldn't be the number one thing that I would bring up.
Okay. All right. So when I think about this, are we talking about loan repayment separately from scholarship?
I think so.
Okay,
So-
so we're gonna bring forward as two
So
separate,
so how I would put it is student loans and tuition assistance as one, and the loan forgiveness as two. We could put it all in one line if we want, but the student loans and kind of parentheses tuition assistance, that would be similar to the grant horizons from 2022 to 2025 for nursing and social work. The loan forgiveness would be what the governor passed this summer for nursing and other professions, but did not include allied health. So to expand that to
Okay.
include respiratory, nuclear medicine, and radiology technologists, I would put them, I think it's fine to put them separately.
okay, all right. I just wanted to, I'm just trying to organize, just to
Yeah.
make sure we have them in the different buckets, so it's clear.
Okay.
And so then thinking about the grant funding, is that, so when we're looking at grant funding as a recommendation, how are we putting that forward?
And again, that was the reason I kind of came up with that from one of the meetings was because looking at the Horizons initiative in 2022 for nursing and social workers, that they had a bucket or so that called it grant funding, and it was different things that were in that grant funding, and it was partnerships. The big thing I saw was partnerships between educational programs and health facilities. And to me, that makes sense for our three programs to create these partnerships, especially for clinical instruction, to help with clinical instruction. But these partnerships can also be to create job fairs within those health organizations to try to promote these professions. So keeping it a little bit loose for grant funding because our different professions have slightly different needs, but to have it be partnerships to specifically help with clinical instruction and for radiology technology, and I'm not sure about nuclear medicine, but to really incentivize people to take on students, which has been, from everything I've heard, a major issue. And then for respiratory, the same thing, to incentivize, but also to offset some of the huge costs associated with it.
Okay, so I'm trying to organize it as a recommendation, right? So when we think about a recommendation, because we keep talking about Connecticut Horizons, right?
Yep.
So do we want to have an overarching recommendation that says leverage the Connecticut Horizons grant in order to include these three professions so that we can, and then rationale it down from there?
I personally don't think we should do that because technically the Horizons grant was 22 to 25, and we're putting this in January of 25. So I don't know what is going on with the nursing task force like we're having right now, and if they're having Horizons 2 or something else. So I would say that we're modeling it after that, but we're asking for it for our own, and we can come up with a fancy name of our own. But I would not necessarily say that because that was a 3-year initiative. Does that make sense?
And then you have social work, which probably started a little bit later, right? So
I think that social work was in the same one. That came out the exact same time.
Okay.
My understanding, it was both nursing and social work in 2022.
Okay. All right. Okay.
Do you guys agree with that? I don't want to be. Do you agree with that? We should not.
So we're going to say similar to the Connecticut Health Horizons grant. We're not going to say. Okay, all right.
But different from the loan forgiveness, I think we should be added to that because that just started.
Right.
This summer. Does that make sense, Matthew?
Yeah.
Okay.
Okay.
Can you agree, Bernadette? Does that make sense to you?
Yeah. Yes. Okay. I'm trying to organize it in my notes. That's all. All right. Okay. So the grant funding, same things, similar. So then we had, the recruitment efforts and then the compact licensure. Were there any other ones that you wanted to add in there?
No. I think keeping it short and sweet, things that will help all three of the professions.
Okay. All right. So we will come up with, we'll present these five recommendations at our meeting. We'll have a rationale, everybody be prepared to talk about and be able to discuss them.
Yep.
We can talk about them as whole. We don't need to talk about them individually. So we can present them as these are the recommendations, and then this is the rationale. So just explaining and answering questions to the committee members.
And would you like us to kind of work on a narrative and email that to you so you can kind of add it to the report? I don't want to put it on you,
Sure.
but I know you started it and I like what you started so far with that.
So-
I'm hoping I can get it done by next week, but.
So, well, you just have to do the recommendations, not the report. So just the recommendations. That's all you have to do. And then your narrative for your own part
Yeah.
of your profession, hold on to it. And then we will,
Okay.
yeah, and then we'll send those off. You can send those off to Beverly and Peter, who can then, they can provide that to me. So that,
Oh, I see. Okay.
so then I can file.
So I'm not sending anything to you prior to next week. I'm just going to kind of work on to be ready to talk about the 5 recommendations that we have. And then I'm also going to work on the narrative, not necessarily for next week, but hopefully start getting it going so that we have it for our report.
Correct.
Okay.
Yes.
Did we talk about the HOSA recommendations that you brought up? Was that one of them?
So HOSA, I think is going to go under recruitment. Do you
Okay,
agree?
that's fine.
Yeah.
Yeah.
Okay.
No, perfect.
Yeah, so I was looking at those big areas, and then underneath that, I was gonna pop them under. So in the actual agenda, I'll have what is gonna be underneath each of the recommendations.
Okay. That sounds
Okay.
good.
Okay, yeah, because I'm doing what you're doing, Bernadette, trying to organize my thoughts.
Yes.
Because and to summarize what I'm thinking, the report at the end will look like sort of a narrative summarizing the problem, right? This is who we are. This is how we affect your health. This is the problems. These are the gaps we have. And then ideally, I think if the recommendations go through, you start with recruitment and basically marketing to figure out how to get more people into it.
Right.
Second recommendation, how to expand the programs to get those people into it. Then the 1, 2, 3 is then, right, loan creation,
Right.
loan forgiveness, grant money,
Right.
through like a Horizons to pay for people getting into this. Does that?
That's great. Hope you wrote it down. Did you write that?
Yeah.
Perfect. Yeah, no, that's perfect. I think that's exactly the way that in the final report, hopefully, that
Right.
they agree with our recommendations, that's the way that we're going to present it.
Okay.
Okay. All right. Any other questions or any other, yeah, go ahead.
Just I want to make sure I have the 5 listed. And I was listening. I wasn't writing as much as I probably should have. Number one, we had student loans, tuition assistance, right?
Yes.
Number 2, loan forgiveness.
Yes.
What did you have actually listed as number 3? Was that grant?
Grant funding.
Grant funding. 4,
Recruitment.
recruitment, that was it. And that's where we're having HOSA and different ones under that. And then 5 was are we calling it compact licensure, or is there a different term we're using?
We can use compact licensure if that's
Is that the same term for different professions? I know that's what we use for respiratory.
We can use that term, or we can
Okay.
find, we can query. I'll look around to see what's used in ours.
Okay. All right, perfect. Thank you. This was
Thank
great. I appreciate all the work that you put into this, Bernadette.
Of
Yeah,
course.
Bernadette, thank you very much.
Of course. Anything else? I have my agenda drafted, so I'll be able to send that because it's coming up pretty quick. So
Yeah, send us your agenda. Yeah, that'd be great.
any other questions or comments that you'd like to make?
No, and I think comment. I think this was helpful to have a subgroup to be able to kind of work through these things. So thank you.
Yeah, and it's great. I think that we've touched on the most important things, and I think that it'll be important for us to be able to express these as our main areas that we think that need to be addressed in order to help with the plan for the shortage, preventing more of a shortage in these areas.
And we also may want to have another subgroup meeting after the meeting on Wednesday, just to kind of fine tune that letter, because we're not going to have a whole lot of time.
Sure. Did you want to come over for Thanksgiving?
I'll be there. Actually, I'm going to be in Nebraska.
So I'll look for another time.
I know it's getting busy, but I just want to make sure we have it all together. So if we don't need it, we don't need it. We can discuss it at the meeting on Wednesday if we think we want to set one more up. And it won't be on Thanksgiving.
That's okay. I think we're in good shape. I think I'll
Okay.
look to see if there's a common date. I think Matthew, you didn't fill out December yet, but that's okay. It's all
I
right.
emailed him back. I think.
Okay, all right, perfect. So I will, I'll look to see what there is available, and come up with a date. All right.
Thank you.
All right. Thank you very much. Have a good one.
Thank you.
Bye.
Thank you. Bye.
Bye, Beverly.
Bye, Beverly.
Bye.